Okay, we catched the basic physiology of the lymphatic system. Now let's see what about the congestions, and we start with the primary lymphedema. The primary lymphedema is not so often from all lymphedema. The primary lymphedema are less than 10% in total. Of these primary lymphedema, about 97% are the result of an incorrect position in the embryonic phase. Only about 3% are genetically inherited. The outbreak of a primary lymphedema must not be right after birth. It can get shown or visible later, many years later, even in adult phase. There are therapy guidelines how to treat primary lymphedema, and those guidelines say it has to be done manual lymphatic drainage. It has to be given compression bandaging. The patients have to wear compression stockings every day and every day and every day. And the skin has to get a cosmetic care to keep it soft and to protect it. For sure, there is a bottleneck regarding those guidelines, and the bottleneck is all that is cost and labor intensive. There are not sufficient professional lymphatic manual lymphatic drainage practitioners who are well trained. And there are disadvantages of the compression stockings. As you remember, last chapter, when we talked about the venous congestions, same situation. Wearing those compression stockings every day and every day and every day leads to the situation that we are going to lose in the collagen synthesis. We are going to get even weaker connective tissue. Above that, the therapy is lifelong, and that means restriction of the quality of the life of the patient. With IVD, with the Vacuumed, that should be installed as a component in the therapy. It can supplement or even replace the manual lymphatic drainage. The IVD can work 24 hours around the clock, every day in a week, every day in a year. The IVD achieves results in edema reduction that cannot be achieved with the manual lymphatic drainage. I'll show you the results right on. And it's exceptionally inexpensive and independent of labor, of staff, and of personnel. Have a look to that one. 19 years old female, primary lymphedema. Only manual lymphatic drainage according to guideline and Vacuumed. That result is spectacular. Usually you keep the edema, there is not a huge reduction. Another case, 25 years old female, before, after, also with the help of IVD, a serious edema reduction. Or here, have a look to this, and there are 6 sessions with Vacuumed only. Primary lymphedema on a child, not a newborn, I'm not sure how old it was, 70% reduction of volume, at least within 13 days with 6 sessions, each session 45 minutes. The therapy results are impossible to achieve with the MLD and the compression therapy only. Once again, the IVD offers new perspectives in the therapy of primary edema. That is what we should know. All that is study proved. There are lectures given, there are practitioners all around the world showing these results every day. We are going to continue with the secondary lymphedema, but that the podcast doesn't get too big, we stop here and continue with the next one.